in which those cells cease to respond to their normal signals around them, in which they form unspecialized masses of cells called tumors. As you can see this part here and here, these are the unspecialized masses of cells developed the lungs. And lungs cancer can also be caused by smoking cigarette, in which in that smoke there is a chemical called carcinogens which affect the lung.
There are stages of lung cancers. It starts from the 0 stage where it affects only at the airway. It starts there at the first bronchiole, and another stage is stage 1 where it is affected the bronchioles in the lungs, and another stage is stage 2A where it affects the loops of the bronchioles in the lungs, and another stage is stage 2B where it affects the alveoles, like this here. Alveoles are being affected by those tumors, and at stage 3 these tumors are spread from the whole lungs, from this lung to this lungs, and at stage 4 these tumors are spread from the whole body and in special organs such as brains and kidney.
How can you determine a person who has lung cancer? One of the signs of lung cancer is coughing for a long time. Here we see a person coughing for more than 2 months. Another sign is chest pain. Chest pain, this is caused due to the coughing for a long time. Another sign is repeated pneumonia. Another sign is weight loss. Weight loss for 2 kg per month.
And also this lung cancer can be tested, where it can be tested by using 2 different tests, which are known as non-invasive tests and invasive tests. Whereby the invasive test, the tests which do break the skin, which involve the use of different materials like surgical lung bioscopy, thoracentesis, and endobronchial lung bioscopy. And also they use this non-invasive lung test, the test which do break the skin directly or interdirectly, which not interdirectly to the part of the human body, whereby it involves the use of different materials like X-rays, position emission tomography, and computer tomography, whereby this is a picture of the X-ray, which is the picture of lung which is affected by the lung cancer. As we see here, this is the part which is affected by the lung cancer, and this is the safe part of the lung.
Also, there are common methods that can be used to treat lung cancer, which are chemotherapy and radiotherapy, whereby radiotherapy has divided into 2 types, which is internal radiotherapy and external radiotherapy. As you can see here, this is external radiotherapy, which involves the using of machines which produce radiation that can go to kill and stop the growing of lung cancer. And another one is internal radiotherapy, whereby it is involved the using of chemical substance which can produce the radiation inside the lungs and stop the growing and development of the lung cancer. Also, the other method is using of chemical radiotherapy, whereby it involves the using of chemicals which produce the substance which stop the growing and development of the lung cancer.